Hello and welcome to the Human in the Machine podcast, the podcast about all things HCI. As ever, I'm your host, Professor Ben Cowan. In this episode, we have the chat I had with Dr Camille Nadal. Our chat discusses what got Camille interested in technology acceptance, the volume of theories around this topic in the field, and the role and acceptance of technology by healthcare professionals and how that impacts this concept. Again, if you like the podcast, please don't forget to review and follow us. And if you want to get in contact with us, you can by emailing us at humaninthemachinepodcast@gmail.com. And thanks to everybody who has given us kind messages and well wishes. Let us know what you think of the topics, if you have any ideas for speakers, or if you just want to hear from us, or leave us a nice message. Again, they're greatly received. So without further ado, let's hear from Camille. Sit back and enjoy. Thanks very much, Camille, for joining us. Really enjoyed the talk today, and I thought it covered an awful lot of area between the aspects of technology acceptance, and I think that's a really interesting combination of theory as well as design practice incorporated within that. One of the things that I'm fascinated by is what got you started in that topic. So what made you think about technology acceptance in healthcare, and what brought you to that domain?
Okay, very good question. So I suppose I started, I have a computer science background, so I started by doing a technical degree in computer science, followed by a bachelor in computer science. So I was very interested in programming, building technology. But then as I went along with my studies, I became more and more interested in people's lived experiences with technology. So how people perceive and experience technology, but also how technology creates or foster experiences, right? So then I did a master's in HCI, and then I became more interested into how technology can support people who are more vulnerable. So healthcare, mental health care, this is an area of interest. That was kind of important to me at the time, and it kind of carried on with my PhD on digital mental health, more specifically, and yeah, people engage in like health interventions, mental health interventions. They would typically be more vulnerable than, I don't know, people piloting planes, or which was very much what was taught in my university. So yeah, kind of taking an interest into how centering the technology around the person and their needs, and also considering the diversity of experiences in populations. So how does this relate to user acceptance? I think the history of the field and evolution of the field is very similar to the history of technology development, how they evolved from being interested into solely like efficiency, productivity, and moving more towards how people experience and accept technology, integrate it into their practices at work or in their life. So as you saw maybe in the models in the start of my talk, there's really been this shift between only considering the technology and how it impacts people to how people actually perceive technology, and then technology then also impacts this perception. So it's really like a bi-directional relationship, and placing the human at the center of this conversation that we have around user acceptance. It's not just about design features, technology features. It's about what make a person who they are, the context they evolve in, the interactions they have with other people that is going to shape how they perceive and feel about technology. So this is what I'm most interested in at the moment.
And that was one of the things that struck me about the talk, and when you were talking about that kind of richness of information and the way that those theories should percolate into practice. I'm going to touch on that in a second as well. But the thing that really surprised me was just the number of models, or the number of things that could be measured. And so, you know, what's your view as a researcher within this when you see all those models? To me, sometimes I was just like, if I'd saw that many, I'd be terrified. so what's your view when you see all those kind of models?
Mm-hmm. So as a researcher, I think, first of all, sometimes it is difficult enough to understand one model. So when you are facing like over 20 models disseminated in publications, it is quite overwhelming and you're not sure where to start. So because this was the topic of my PhD, I had the opportunity to do a full review of the models out there. But of course, this is not an option for many people. So really having tools or ways to facilitate people's understanding of the theories out there, what theory matches best what they're trying to do in their research. This is really something that is needed, and this is why we created the Technology Acceptance Toolkit to kind of address this particular issue. Having that many theories, it also reflects the different context of use of technology or the different technologies that are out there. As I said, it started at kind of with this focus on technologies for the workplace, going more into technology for everyday life, and then moving on to specific contexts. So healthcare, mental health care, not so much covered, right? So this is why like we have models that have been validated. Most of them are addressing contexts that I suppose are easier to evaluate or easier to access. So like evaluating a model for technology acceptance in the workplace, you're talking about employees. This is very low risk compared to evaluating a model that's for digital health, where you'll be potentially interacting with patients. So yes, and in terms of like moving on to the mental health space, there are challenges. I suppose use of technology for mental health is more recent than just digital health. So it's not so much used in terms of like clinical pathways yet. It has been started, so Ireland has started implementing or delivering digital therapy in Ireland since 2022. So it's just been over a year. So it is quite recent, right, having this digital therapy tools or digital mental health tools offered by national health services. There's few of them, and countries are doing differently. So I suppose implementation of technology in like a validated or endorsed kind of way is something that's very new, yes. So maybe that is why the theory has been a bit behind in that space.
And what is it about mental health, do you think, that makes it quite tricky from a technology acceptance point of view? Because one of the things I was really struck by was that aspects of seeing many different technology acceptance models for work, for digital healthcare more generally, and then that stark finding of yours that's just that there's no technology acceptance models for mental health. So there are very few that address it head on. So what do you think is the reason for that? Why is that the case?
Yes, so I don't think I have the answer to that question, but I'll try to discuss it a bit with you. So I think when you talk about technologies for the workplace, technology for health, we're talking about interventions that are quite like framed in terms of, so they have a start, they have an end. It's very structured in terms of like technology for work, which is maybe less structured in terms of technology for mental health. People can have access to like mental health support anytime, anywhere, through a chatbot, through a mobile app, etc. So I would think that there might be other factors, maybe very different factors, impacting people's acceptance. And because it is so kind of flexible, the use of technology in that context, it's really based on having access when when you can, basically, having this app when you have time to use it, things like that. So digital therapy, logging into when on the portal to do your kind of therapy practice, like thought reframing, things like that, on your own time and when you have the chance. So there's different factors that would impact, I presume, acceptance that wouldn't be necessarily in the context of health or other contexts. For example, if someone has caregiving responsibilities, that might reduce their availability. If there is a particular stigma around mental health in cultures, communities, people might face, typically the barriers people face towards accessing mental health support might be reproduced in accessing mental health support provided by technology. So I'm not sure that answers your question.
Yeah, no, it does, because it kind of touches. So for me, that there's especially the social points of view and the stigma views, the stigma of gaining mental health supports. And I think you mentioned there that in some of the barriers, that they're particular kind of male barriers or around those things. I think that I was wondering maybe whether that was something to do with that it's actually a very complex acceptance model compared to potentially other forms of care. And I think that's what that's definitely something that came highlighted in the talk. And I think that was really interesting as well, with the element of the long-term evolution. And I think you use the term evolution a lot, and I really liked that, because it highlights that thing about how acceptance evolves. How do you think that evolves within mental health, and are there things that we should be thinking about when we think about the long-term evolution of technology acceptance?
In terms of evolution of acceptance factors for mental health, you need to consider what kind of intervention or what kind of care the technology is providing. Do you want users to keep using your technology providing mental health support? Or would you want to help users build skills to then not need the technology and become just self-reliant, not be reliant on a piece of software or an app to manage their mental health? So I'm not sure, depending on what intervention you're building, you might not want people to actually keep using technology in the long term.
Yeah, that's an interesting one that's been discussed as well in the behaviour change community and the behaviour change space. What happens when that behaviour that you've built a technology for, that habit has been built? So then do you need to take the technology away, or do you need it there in sporadic moments? I think that's an interesting aspects around healthcare, because if you become reliant on some of that, what's the who makes that decision? I suppose who makes that decision about how long? Is it the mental healthcare professionals, or is it the patient themselves, or the clinic, or the client? Who makes that decision?
Yes. So depending on the service provided in terms of mental health care, some services would be limited in time. For example, digital therapy program, you might have access to it through the duration of the program, and then maybe the following year, and then your subscription would be stopped. So you wouldn't really have a decision to make there. The choice would be taken away from you. It's just gone. But in terms of deciding whether to keep using, say, a tool for mental health support that is not supported by human supporters, because I suppose if there was a human supporter, they would kind of say, okay, maybe you don't need the support anymore, you don't need the service anymore, which I'm not sure would happen, depending on the motivations behind the provider. But if it is not supported by humans, you would have to make the decision yourself. And it is a bit similar to going to talking therapy and making the decision of, okay, now I feel better. I suppose I also don't want to be spending like 70 quid on sessions for the rest of my life.
Yeah.
So maybe you have that kind of reflection and self-awareness on whether you feel good enough to now move on just by yourself. In terms of, like, if it is a mental health app, I don't know, you can just stay on your phone and you're just not using it. I don't know at what stage you would be actively like, okay, I'm deleting this, I don't need it anymore. It might just become one of those ghost apps that are on your phone.
Well, there, I suppose, whenever the person feels it's required as well. I think that's the beauty of of aspects of digital technology in healthcare. I suppose if the person feels they still need it, they can still utilize it, I suppose. But I wonder, getting into the role of digital tools in healthcare, what do you feel the role of the healthcare professionals are in the situations that you see? So there's technology acceptance, for instance, from the client or the user point of view. But is there any technology acceptance issues for the healthcare practitioners sometimes when it comes into that?
Of course there is. The study I presented was very much looking at patient acceptance. Now if you're looking at professional acceptance, you're looking at potentially different factors that come into play. Typically this is kind of going back to work, technology for work. So there would be like integration into their workflow, not disrupting their work practices, the resistance to change, things like that would be hugely impacting their acceptance. I am actually currently interviewing mental health professionals on their thoughts on potentially collaborating with AI to provide mental health support. So there's definitely issues, barriers to acceptance, but also facilitators in terms of like really supporting them, and there is like a huge mental, emotional burden that they face, receiving all these stories from clients they support. So there is really a space where technology could support them, but there are obviously barriers to especially AI. That is something that's even if a lot of fields or industries are going towards integrating AI, the mental health field and mental health professionals, that is something that is quite scary for them. Could that replace them? Things like that. So what does that mean for clients in terms of the care they receive, the quality of care they receive? So, yeah.
And is that and so in terms of future work, in terms of future aspects, do you feel that's where digital tools are going? This kind of merging AI tools within those interfaces or those experiences, or what's on the horizon for healthcare professionals and mental healthcare professionals, and also what's on the horizon for technology acceptance research as well. So, what do you see as the next things to look at and to focus on?
I think what's on the horizon should be kind of down to them, really. We shouldn't be trying to push productivity or taking in more clients at the cost of quality of care and time spent on each client. But typically, even if we do integrate technology, AI or things like that, into the practice of the practice of mental health care, sometimes it just duplicate the work. And so this is why we need to talk to mental health professionals, because an AI technology that is going to assess risk, for example, or a chatbot talking to client providing mental health support, sometimes the therapist is going to be like, I will still have to review all the data, to review all that the client says, because how good is that AI at actually detecting risk? And we're talking about really important consequences where someone might not use like the keywords for suicidal thoughts or ideation. It might kind of be about reading between the lines. So how good is AI at noticing these things and having the appropriate behavior in terms of risk management? So a human is, I think the state of technology is that a human is still needed to do that risk assessment and not be in a situation where we're missing someone who is in actual immediate distress and not validating them or not proposing like an appropriate plan for them to get help.
Thanks so much, Camille. Again, don't forget to review and follow us, and if you want to get in contact with us, you can by emailing us at humanandmachinepodcast@gmail.com. But all that's left for me to say is, I've been Ben Cowan. Stay curious, and don't let the machines get you down. Until next time.